Hi, welcome to PK's classes. Today we will study antiplatelet drugs. Platelet, as you know, platelet is a type of cell present in the blood. In blood we have three types of cells, the RBC or red blood corpuscles or erythrocytes, the white blood cells or leukocytes and platelets. And these platelets are useful in your blood coagulation. Okay, and if these platelets aggregate, so if there will be aggregation of these platelets, that will form a block in the blood vessels, so they affect the blood flow. The blood flow is affected in the blood vessels if there is platelet aggregation, and this is why it is a cause of many cardiovascular diseases like your angina pectoris, okay, and ischemia, angina, ischemia, all these diseases, myocardial ischemia. So all these diseases are caused because of platelet aggregation. So there is the use of antiplatelet drugs. So this platelet aggregation is activated when there is atherosclerotic plate. Atherosclerosis, we know atherosclerosis is deposition of cholesterol in the blood vessels. So when there is plaque of atherosclerosis, that causes the adhesion of platelets. So adhesion of platelets to the thrombogenic surface, and this causes the activation of platelets. So when there is activation of platelets, they release arachidonic acid. So arachidonic acid is released due to activation of platelets, and this arachidonic acid, by the action of cyclooxygenase enzyme, is converted to prostaglandin G2 and prostaglandin S2, the cyclic endoperoxides, which can produce thromboxane A2 as well as prostaglandins. So by the action of thromboxane A2 synthase, thromboxane A2 is produced, and by the action of prostaglandin synthase, the prostaglandins are produced. Among the prostaglandins, one is prostaglandin I2, D2, E2, I2, F2, alpha, like these prostaglandins are there. So, and one of them is prostaglandin I2, which has an action on platelet aggregation. So it inhibits platelet aggregation, and thromboxane A2 causes platelet aggregation. So thromboxane A2 activates the or causes the platelet aggregation, whereas it inhibits the platelet aggregation. But the role, the dominant role is that of thromboxane A2. So since the thromboxane A2 has a dominant role on platelet aggregation, so the net action, because of arachidonic acid and all these generation of thromboxane A2 and the net action will be platelet aggregation, because the action of thromboxane A2 is dominant. So if we can inhibit the COX, then the net action will be inhibition of action of thromboxane A2. So the platelet aggregation will be inhibited. So we can inhibit this COX by drugs like aspirin. So aspirin inhibits COX and inhibits the generation of thromboxane A2 and inhibits platelet aggregation. Okay, so this is one. And how this thromboxane A2 has a role in platelet aggregation, let us now discuss that. So thromboxane A2, so suppose this is a platelet and this is another platelet. So when we say platelet aggregation, means this platelet will be attached to this platelet. Okay, and this attachment occurs by means of fibrinogen, and there is a receptor called GPIIb, GP2B, a glycoprotein receptor, and on this there is attachment of fibrinogen. So this fibrinogen acts as a link between two platelets, and where on the GP2B or 3A receptor. Okay. So when there is arachidonic acid generation, from arachidonic acid there is your prostaglandin G2 or H2, and from this you have thromboxane A2 and also prostaglandin I2, and this thromboxane A2 helps in expression of GP2B or 3A receptor in the platelets. So thromboxane A2 for expression of this receptor occurs because of thromboxane A2, and then when there is exposed collagen, that also activates the production of IP3 and DAG. So there will be from phosphatidylinositol diphosphate EIP2, there will be production of arachidonic acid as well as IP3-DAG, and these IP3-DAG, they help in release of the ADP, 5-HT, etc. from the platelets, and this ADP also helps in expression of GP2B or 3A receptor, and ADP binds to ADP receptor also on the platelets, and when there is expression of GP2B or 3A receptor, then there will be action of this fibrinogen which binds to GP2-3B receptor, 2B or 3A receptor of two adjacent platelets, and these adjacent platelets are linked via this fibrinogen, and this causes the platelet aggregation. Okay, so another one, we have your prostaglandin I2. So when prostaglandin I2 acts, it is a G protein on the specific receptor, that is IP receptor, which is a G protein coupled receptor, and there will be production of cyclic AMP. So ATP is converted to cyclic AMP, and this cyclic AMP inhibits the release of ADP, 5-HT, etc. So prostaglandin I2 can inhibit ADP dependent platelet aggregation. Okay, so ADP dependent platelet aggregation means expression of GP2B 3A receptor and then linkage of two platelets via this fibrinogen. Okay, so two platelets are linked via fibrinogen. So this is a platelet, this is a platelet, and they are linked, and this is your GP2B or 3A receptor. Okay. So we can use prostaglandin I2 analogs like Epoprostenol. Okay, or we can increase the concentration of cyclic AMP, because cyclic AMP is degraded to 5-AMP by the action of phosphodiesterase. So phosphodiesterase enzyme degrades cyclic AMP. So if we can inhibit the phosphodiesterase like by drugs like dipyridamole, then we can increase the level of cyclic AMP and we can inhibit the release of ADP. So ADP dependent platelet aggregation is inhibited. So ADP dependent platelet aggregation means ADP helps in expression of GP2B 3A receptor, and the two adjacent molecules, two adjacent platelets, then they will be linked via fibrinogen, and this causes aggregation of platelets. Okay. Then we can use ADP receptor blocker, or we can inhibit this ADP dependent platelet aggregation by drugs like clopidogrel and ticlopidine. Okay, we can use inhibitors of GP2B3 receptor antagonist like abciximab, tyrofibon. So we have 5 groups of drugs. One is your aspirin, second is epoprostenol, third is dipyridamole, fourth is clopidogrel ticlopidine, fifth is tyrofibon. So we can classify these drugs as inhibitor of COX, aspirin, inhibit ADP dependent aggregation, ticlopidine, clopidogrel, and GP2B or 3 receptor antagonist. Monoclonal antibodies like abciximab can be used, and oligopeptides like tyrofibon can be used. Prostaglandin I2 analogs like epoprostenol, and PD inhibitor like dipyridamole. So all these drugs can be used in acute myocardial infarction, unstable angina, coronary artery bypass grafting, coronary artery angioplasty, in addition with stenting. Okay, transient cerebral ischemic attack, atrial fibrillation if oral anticoagulation is contraindicated. So mostly all these antiplatelet drugs are used in cardiovascular diseases where there is a block in the blood vessels. Okay, thank you.